and good morning. You're watching Agenda here on One News. I'm Edwin Gao, just sitting in for Cito Beltran. Today we will be interviewing Undersecretary Ireneo Vizmonte of the Department of Trade and Industry and Undersecretary Maria Rosario Vergeire of the Department of Health. Now, first off, let's take a look at the front page of today's edition of the Philippine Star. Philippine Ambassador to India, Ramon Bagatsing Jr. says that the national government is ready to repatriate Filipinos in India who want to come home. There are around 2,000 Filipinos right now in India. And Bagatsing earlier said that there are around 150 who may want to come back home. And Bagatsing clarifies that this would only be done when commercial flights resume. Bagatsing explains that it is logistically difficult to start a repatriation flight since many countries have already issued a travel ban on India, the Philippines among them. And in other news, Octa Research reports the continued downtrend in new COVID-19 cases in the National Capital Region. Octa fellow Guido David says that in the past 7 days, they have seen a decline in the average number of new cases by at least 11%. And the Department of Health is looking to wrap up the COVID-19 vaccination among the 5 priority groups within the next 2 months. These groups are those that fall under Category A, which would include health workers, senior citizens, and persons with comorbidities. I also understand that this would include, I think, A4, which includes frontliners from the economic sectors. And moving on, let's start this day with this day's set of interviews. We first have Department of Trade and Industry Undersecretary Ireneo Vizmonte. Yusek Vizmonte also serves as the Chief of Staff of the DTI. Yusek Vizmonte, welcome to Agenda and happy Monday.
Magandang umaga po, Sir Ed, and happy Monday at sa inyong mga tagapakinig sa pong magandang umaga.
Good morning po. Huwag kayo masyadong formal. Lunes na lunes eh. Well,
last Friday lang pala magkasama.
Nagkita lang tayo ng Biyernes. Well, Yusek, the implementation of the new, you might say, business protocols started nung May 1, Saturday. Specifically, we're talking about yung 30% allowed capacity for personal care services and 10% for indoor dining. Well, first off, kamusta po implementation nung magmulan Sabado?
Naayos naman po. Meron po tayo mga bumisitang mga frontliners po natin dito sa simula ng pagbubukas ng mga dine-in at saka personal care services. So maayos naman po ang pag nakita po namin. Alam niyo naman kasi hindi naman to bago sa kanila dahil bago po mag-Marso ay talaga namang umaandar na sila, no? Bukas na sila bago pa mag-Marso nung magsimula tayo.
Ito yung GCQ. Nung GCQ pa tayo. Dahil basically pareho naman yung numbers ng GCQ, no? If I remember right, was also 30% for personal care and 10% for indoor dining, ganun ba?
Nung nga lang pong GCQ, medyo mataas na po yung allowed natin dito sa mga establishments na ito. Maabot po ng hanggang 75% under GCQ.
Okay. I stand corrected. But sir, just to be clear po, para malinaw sa lahat, kasi when you see personal care services, yung mga tao mag-chat niyan ikaw ba personal care o hindi? So ito mga pinayagan na 30% allowed capacity, in particular, specifically, ano po itong mga ito? At ano po ang hindi kasama dito?
Ang pinayagan lang po ay yung po mga barbershops, beauty salons, beauty parlors, at yung po mga nail spa. Ito po yung mga meron sa hair treatment at saka mga nail treatment. Pwede pong nagugupit o kaya yung nagpapaayos ng buhok o kaya yung nagpapaputol ng kuko or nagpapapedicure or manicure.
So hindi kasama dyan yung mga masahe?
Hindi pa po kasama.
Ba't
Yan
kayo
po ay
natatawa?
talagang napag-usapan po, hindi po lahat ng personal care services, bawal pa po ang masahe.
Okay, okay, okay. Yung mga nagpapagupit din, hindi pa rin pumamasahe, siyempre.
Oo, hindi naman ho, kung ano lang po yung kailangan sa pagpapagupit. Yun na muna. Alam ko, yung iba po dyan may konting masahe pagkatapos ng haircut eh.
Okay. So just to carry on with that conversation, so hindi pa pwede yung mga spa, mga massage parlors, but as well I understand pati yung mga sinehan at yung mga and similar such venues hindi pa rin pwede.
Yeah, tama po yan. Yung mga cinema po, yung mga amusement park, o kaya yung mga, sila po ay sarado pa, no? Hindi pa po sila pinapayagan at this time. Kasama na po rin yung mga venues for meetings, incentives, and conferences and exhibition. Kadalasan po rito yung mga hotel. Yung po mga indoor tourist attraction, and even outdoor tourist attraction. At saka, yun nga po, yung mga gyms, spa, indoor leisure centers, hindi po sila pinapayagan po.
Okay. And what challenges did you notice since Saturday in putting this in place? These well, they're not really new, no? But in allowing these establishments to come back to what challenges did you see? Were there any problems?
Wala naman po tayong nakitang problema dahil hindi naman po ganun kahirap yung pagpapa-implement nito dahil napakaliit nga lang po ng pinapayagan. Pero siyempre po yung atin po yung mga ano po natin, yung mga nandito po sa business na to, ay gusto po sana nilang makapagbukas pa ng mas marami kasi kung 10% lang lamang po yung dining, talagang hindi pa po sila kikita dyan. At ganoon din po yung personal care services. At 30%, maliit lang po talaga. At hindi pa rin po talaga makakapasok lahat ng ating mga trabahador.
Actually, Yusek, I was wondering nga about that. So this is more of a half step lang than a full step. Kasi when you look at only 10% of indoor dining, a restaurant with a capacity of 100, 10 lang yung pwede mong pakainin dyan. I'm wondering how restaurants could afford to keep on operating at 10% capacity or indoor capacity. Baka in the end, malulugi lang sila.
Yeah, maganda lang pong aspeto nito ay allowed po yung take-out at saka yung mga deliveries. At kung meron po silang outdoor, yan po ay napapayagan din.
Well, the same question goes for yung mga barberia at saka yung mga beauty parlor. At 30% capacity, kung 10 lang dati, bear in mind, yung barberia, kukunti lang ang upuan yan. Kung 10 ang upuan mo, 3 lang ang pwede mong paglagay ng tao at any particular time. Well, unlike restaurants, walang take-out yan. So of course, that does bring up the question na how sustainable can this arrangement be and for how long?
Hindi po natin nakikita talaga na ito ay magiging viable at sustainable. Kailangan po talagang ay mabuksan na muli sila at a higher percentage. At kung hindi man po sa pagbababa ng ating quarantine, baka po magkaroon ng pagkakataon sila dun sa ating sinasabi na kung sila ay merong stay safe certification ay meaning yung certification po natin doon sa mga sumusunod sa mga safe protocol ay baka mabigyan sila ng mas mataas na capacity to operate.
Well, sige sir, I will go into the stay safe sticker in a few minutes or maybe after the gap. But let me push on with some of these questions. For example, I'm trying to imagine lang kasi ako I haven't had a haircut in a while ako na mismo gumugupit sa sarili ko pero I'm trying to imagine kasi I do understand that under the protocols you are supposed to keep your mask and your I think your face shield or yung mask lang. You're supposed to keep them on. Face mask lang. So yung face shield hindi naman necessary. I'm wondering lang how difficult it is to get a haircut with your face mask on. Yun na nga yung pagputol ng patilya baka maging FPG yung dating mo pag hindi ka magupitan ng patilya
Ako, haircut ko lang kahapon eh. So I was able
Oh,
to finish without removing my mask. So ganun din po yung nagugupit sa akin. So buong length po nung aking haircut ay nakasuot po ako ng mask. Ano. Meron silang way eh. I think nire-rotate nila yung yung ating yung tali po sa tenga no para to allow shaving of your patilla.
okay. Okay. I shall keep that in mind. Sige. Oh. What about yung mga salon well, sabagay, hindi ko pa nasubukan yun. Magpatina ka ng buhok o ang tawag doon, yung
Hair
magpa-plancha?
dye.
O,
Yung baka mga treatment po sa gupit sa mga salon, pwede po yan. Basta po yung kanilang mga mask ay hindi nila tatanggalin. Pero kung yung proseso po, yung procedure na gagawin sa kanila will require the removal of face mask, dapat hindi po nila gawin yun. Hindi po
okay.
hindi po kasama yun.
Oh, okay. That's interesting. I'm sorry, I'm not that familiar with the procedures sa mga beauty parlor eh. What procedures are you talking about? I'm sorry, you have to educate me there.
Baka po kasi merong nagpapaganda, halimbawa makeup, that will require removal of your face mask. Ano? So hindi pa po pinapayagan yan.
Ay, okay. It's good that you brought it up because those are the details that of course do not get included in the black and white. Sige, let's go specific there. So, ano po yung mga, of course, allowed yung beauty parlors, allowed yung barberia, anong hindi pwede that you can see or that you can remember, anong hindi pwedeng go in doon sa loob? For example, yung mga examples na bibigay ninyo.
Yun po, yung mga makeup po na o kaya masahe ng mga facial massage, yung pong mga derm treatment na dito po sa mukha po natin, hindi pa po sila pinapayagan. But yun pong ibang mga derm talaga, kahit saan pong part, ay talagang hindi pa rin po talaga sila kasama dito po sa mga pinapayagan. Ang sinasabi ko lang po, in a hair salon or a barber shop, meron kahit na bukas po sila, hindi lahat po nung kanilang procedure sa kanilang mga establishment ay pwedeng gawin.
Wala naman kayong problema so far. You have not monitored any problems as far as those are concerned. You have not come across any beauty parlors or barbershops that have gone to that. I wouldn't call it extreme, pero to that measure.
Pero hindi ko pa lang ho alam dahil alam nyo yung siguro today, kasi hindi lang ho DTI ang nagmo-monitor eh. Kasama ho natin ang LGU, ang DILG, at ang Department of Labor and Employment in monitoring compliance to the minimum health protocols.
Okay. Well, Yusek Vizmonte, we will just go into a break. I hope you can stay with us. Agenda will return with Trade Undersecretary Ireneo Vizmonte after this short break. So keep it here in the agenda. You are back here in Agenda. I'm Ed Lingao, sitting in for Cito Beltran, and we are still with Trade Undersecretary Ireneo Vizmonte of the Department of Trade and Industry. Yusek Vizmonte, thank you for staying with us. Yusek, earlier we were talking about the safety seal that
Yeah.
the DTI is encouraging establishments to get. I suppose the easiest way to describe it or to characterize it is patong parang PS mark ba?
Yeah.
Tama ba?
Um,
Parang
yung
product safety mark?
Yeah, yung product safety mark po kasi ay mandatory. No? So,
Yes.
but this one, ito pong ating pinag-uusapan ngayon ay hindi po mandatory. Voluntary po ito on the part of the establishment if they want to be part of the program ng safety seal. Ay sorry, kanina nabanggit ko hindi safety seal eh. Sabi ko stay safe. But stay safe is part of the safety seal certification.
Which also brings me to my question, bakit hindi siya mandatory? I mean, this particular point where we are so concerned about the safety protocols in the establishments, in commercial establishments, why didn't we go the extra step and make it mandatory na you have to get, for example, a safety seal before you can open your establishment?
Yeah. Actually, gusto po talaga sana namin makabalik yung mga trabaho. At pangalawa, yung related to that ay kung gagawin po namin inspection muna bago sila pagbubukas, medyo mahihirapan po tayo. Dahil hindi naman ganun karami yung bibisita sa kanila. So ang ginagawa po namin talaga in relation to inspection ay post-audit po tayo. Bukas muna sila, tapos sisilipin na lang po natin kung nagko-comply sila. At kung hindi sila nagko-comply, we'll try to correct them yung violation nila within a period of time. Ano? At kung sila naman ay paulit-ulit na, so i-report na po natin yan sa LGU. Dito naman po sa safety seal, ay kaya po siya voluntary, ay ayaw nga po natin sila ay yung pagbubukas nila ay parang on condition on the issuance of the safety seal. Ayaw po natin yan dahil baka nga po lalong mahirapan sila sa pagbubukas. So kaya po itong safety seal ay gusto lang namin kampanya. Ito po ay kampanya lang po natin para makapagawa ng lumakas po ang confidence ng publiko sa ating mga sa paggamit o pagpasok sa mga business establishments na particularly mga dine-in at itong mga personal care services. Pangalawa po, ito ay isang programa that will provide information to the public and for them to have the choice where to go. So dahil kung halimbawa meron po tayong safety seal, nakalagay po yan doon sa entrance nila, no? Na meron silang safety seal certification, nagpapatunay na sila ay tumutupad doon sa alituntunin ng gobyerno when it comes to the compliance to minimum health protocol. Yun po ang dahilan kung bakit hindi po talaga natin sila naging mandatory dahil ayaw naman po natin maging requirement ang safety seal para sila pa ay makapagbukas.
So you say, what you're saying is that establishments can get the safety seal when they comply with the minimum
when they
health
apply.
standards.
When they apply and then they are able to be assessed as compliant.
As far as yung minimum health standards are concerned.
Tama po yan.
So this is not a higher level of you might say not necessarily a higher level of safety on the part of the establishment. It is just the minimum that you have met the minimum.
Correct. Tama po yan, Sir Ed. So yan po ang ini-expect lang po natin para yung mga publiko nga po ay malaman nila kung at mayroon silang pagkakataong mamili between establishment yung walang safety seal or yung meron.
But theoretically, well, at least theoretically, because you're talking about the bare minimum, all establishments should eventually have a safety seal.
Tama po yan. Kung masusuyod po natin lahat na ay meron po silang safety seal na magkakaroon po ng validity na 6 months. Ano? But of course, these are subject to inspection at kung meron po silang nakitang hindi pagtupad, pwede pong bawiin yung kanilang safety seal certification. Kaya mahalaga po na ito po ay tuloy-tuloy. They have to sustain the implementation and observance of the minimum health protocol in their respective establishments.
Which brings me to the other question, of course, that if this is only for the minimum health standards, will the safety seal eventually become mandatory? I mean, I do understand na at this point, kailangan pang voluntary yan kasi medyo kulang ng tao para mag-inspeksyon. Pero considering it's the minimum health standard, are you looking at making it eventually a mandatory seal? Parang PS Mart.
Hindi, sige, pag-iisipan po natin, ano. Pero ang nasa isip po namin ngayon ay gagawin po namin itong incentives. Yung maging incentive, kung halimbawa kayo ay may safety seal certification, baka mas mataas po yung ibigay sa inyo na makapagbukas. Kung halimbawa 10% po ngayon, baka payagan po kayo at 20% or 30% kung halimbawa kayo ay mayroong safety seal. Yun po yung nakikita namin ngayon para po merong insentibo na sumali sila at mag-apply for safety seal certification.
Okay.
Pero tama kayo, pag-iisipan po namin yung mandatory compliance safety seal.
So your safety seal, if your store has it, your safety seal may be sort of your permit to increase your capacity.
Tama po. Tama po yung nabanggit niyo, Sir Ed. Pwede ho natin gawing incentive yan sa mga establishmento na nagkaroon na at magkakaroon pa ng safety seal certification.
Well, sir, run us through the process of securing this safety seal. Just how simple or complicated is it?
Number one, wala po itong bayad. Dalawang paraan po yan. One is pwede kayong mag-apply at after application ay pwede naman kayong bisitahin na at tignan kung kayo nagko-comply. Meron po tayong parang ilalabas na parang self-assessment tool para alam nyo kung kayo ay papasa. And then pwede rin ho na during inspection, in the regular inspection na ginagawa po natin, nakita po natin na kayo po ay pwede pala kayong pumasa dito sa safety seal certification, pwede po namin kayong alukin. At kung papayag kayo, ilalagay na po natin yung safety seal sa inyong establishmento. So dalawang paraan.
Okay. I was reading your guidelines that were issued, I think, nung Friday. Iba't ibang lugar, iba't iba yung nag-accredit, diba? May LGUs,
tama po yan.
and so on down the line. So there are specific agencies in charge of looking into the qualifications of those applicants.
Tama po yan. So personal care services, ito po ay pangungunahan po ng DTI. Alam ko po yung mga dine-in ay LGU po ang haharap po dyan. So alam ko meron din pong covered ang DOLE. So tulong-tulong po kami rito, including mga government offices po ay kasama po dito sa safety seal certification.
Yusek, very quickly lang, ano yung titignan niyo dun sa sa inspections niyo? Ano yung kasi of course we are talking about minimum protocols pero specifically what are we going to look at?
Yung pong halimbawa yung pagpasok nyo, ginagawa ba yung health declaration, yung pagkuha ng thermometer,
yung form.
Yung bang meron ba silang stay safe app dun sa kanilang establishment o kung hindi man yung app na nire-require dun sa lugar na yon. Kung meron ba silang mga sanitation, availability ng mga alcohols, sanitizers, meron ba silang, yung mga kliyente ba at mga empleyado ay nakasuot ng face mask at face shield kung sa lugar ng kanilang ng pwesto. No? Kasi alam niyo naman po yung face shield, hindi po laging kailangan required. Ano? Meron pong mga type ng trabaho na pwedeng yung face shield ay tanggalin, lalo na kung kailangan ng malinaw na mata para po dun sa inyong ginagawa. So, yung ventilation po, kasama po dito, no? Kailangan po may magandang ventilation, tuloy-tuloy po yung hangin. Kaya po, kung mapapansin nyo, una po natin pinayagan yung mga outdoor establishments kaysa ron sa indoor. Kasi nga po, nakita natin with the new variants, yung kahalagahan nitong ventilation sa mga mga workplaces po natin at yung mga lugar na dinadayo ng mga publiko.
Yusek Boy, one more before I let you go kasi importanteng bagay ngayon yung ventilation. I read the study conducted by 6 researchers on the Lancet, that's a medical journal, na there are clear indications of the virus being airborne. In which case nga, napakahalaga ng issue ng ventilation eh. Pero ang problema, I would suppose, ang problema kasi with ventilation is that uh, that's something that's very difficult to assess. Technically, technically, it's very
Kasama kayo.
difficult to assess.
Yeah, it's
Hindi kagaya ng
difficult.
naka-face shield ka ba? Hindi ganoon eh. Ventilation, you would have to look at air circulation, you would have to look at air exchange or gas exchanges and so on down the line from one end of the room to the other.
Tama po yan.
Exactly how are we doing that?
Yung pong guidance po natin ay pinangungunahan po ng Department of Labor and Employment kasi po yung pag-comply po natin dito in accordance dapat doon sa DOLE Circular on Ventilation. So, which was recently upgraded or revised to consider ito pong senaryo ng COVID-19. So, alam ko meron pong gadget na sinasabi sila that can really measure whether there is enough exchange of incoming or outgoing air sa isang establishmento. So, in other words, kung sariwa ba yung hangin na pumapasok doon o umiikot lang yung hangin sa establishmento. So, yun po ay meron daw pong gadget for that. I also heard this in a meeting na we conducted in the process of finalizing these DOLE ventilation guidelines.
Okay, with that, we will let you go. That's Undersecretary Ireneo Vizmonte of the DTI. Sir, maraming salamat for joining us and good morning.
Good morning, sir. At sana mabuti kayo sa kalagayan ngayon at always stay safe.
Thank you, sir. We hope you have a good week today.
Thank you.
And agenda returns with Health Undersecretary Maria Rosario Vergeire, who now joins us. Yusek Vergeire, thank you for being with us this morning.
Magandang umaga po, sir. Good morning to all of you.
Good morning, ma'am. Ma'am, of course, very worrisome news still coming out of India. The last I checked, I think this was yesterday's figures, 392,000 new cases in India, 3,689 deaths. So for the past 10 days, they've been breaking more than 300,000 new infections every day. That's more than 3 million people or new infectees in just 10 days. So everybody's really worried about India. I'm wondering, I'll just start off with a very general question. Do we have enough protocols in place to make sure that we don't go in the same direction?
Well, we had been discussing about this, no? And we are seeing how the country of India is getting overwhelmed. And of course, our government would not want for this to happen in our country. That's why we are reviewing now our protocols, especially for border control. We are now we have these discussions right now on what countries should we watch out for, especially those travelers coming in from these countries. And we would like to ensure that our isolation and quarantine protocols are in place.
Okay, that's interesting, Mom, that you mentioned that, because I understand that the Philippines is allowing now, at least to a limited extent, the entry of foreigners, except those coming in from India and those who have been to India in the last 14 days, which does make sense that you still have a limitation for people from India. However, I also understand that the Indian variant, if you might call it that, B16, 17, has been found in 16 or 17 other countries. The last one being Malaysia. Yesterday, they discovered one visitor in Kuala Lumpur who had the variant. So would we need to tighten the borders some more, not just vis-a-vis India, but other countries as well?
Well, we are on to that direction already, and we have submitted a letter to the president. No, so we had a memo for the president over the weekend, and we will wait for the approval of the president regarding this recommendation. What we did also was we had a meeting last Friday among the different concerned agencies when it comes to the control of our borders. And we have to ensure that the 14-day quarantine period will be implemented, no, especially for those
Yes, ma'am.
incoming travelers.
Yes, ma'am. Ma'am, I know that of course you might be limited in what you can reveal as far as the contents of your letter are concerned, but at the very least, are we looking at a recommendation to further tighten border controls in this letter that you talked about?
Yes, it's really about tightening border controls.
Mhm. Would you be free to tell us to what extent? Kasi nga, yun nga, I understand that just recently we agreed to or we decided to open to allow foreigners to return to the Philippines. So I'm wondering lang to what extent.
Yes, we are identifying countries where we need to have tighter border controls. So that's one. And the second, even though we have opened up our borders to these foreigners, these are the foreigners with existing visa. And
Mhm.
also, as I've said, we are now ensuring that the 14-day quarantine be strictly implemented.
Okay, very strictly implemented. Ma'am, I hope you don't mind. I'd still like to ask a bit about India because yun nga, everybody's really concerned about that. The numbers are staggering and the images are also staggering. And and we talked to Ambassador Bhagat Singh just last week. And this is what he told us. Of course, he's not a doctor. He's a diplomat. But this is what he told us. He told us that it appears that the problem in India was not necessarily social behavior driven, but more of variant driven. I suppose he was talking about the B1617. But I tried to read up on it, and so far I couldn't find anything substantial that would point to an Indian variant being, well, specifically more deadly or more transmissible. What do we know about it?
Yes, this India variant really is a variant under investigation, meaning we still do not have sufficient evidence as to its pathology. What does it do to a person? But what we know right now, it carries the two mutations, this
Mm-hmm.
E4K, and also the mutation which is found in the UK variant. So when you talk about the mutation from the UK variant, it is more transmissible. And when you talk about the mutation coming from the South African variant, it has this immune escape mechanism. So these are the two things that we have information right now regarding the India variant. That's why they call it the double variant. But we have to understand also that there are still other mutations included into this India variant, and this is still being investigated.
So it is still a variant of. I'm sorry, it's not a variant of concern. It's a variant of interest. Is that correct?
It's a variant under investigation.
Under investigation. Okay, so it has not yet gone to the next level, which would be a variant of concern.
Yes.
Not like the other variants, like the South African or the Brazil variants.
Yes, that's how they classify it, the WHO, because they still need to complete their investigations before a variant becomes a variant of concern.
Mm-hmm. Ma'am, the other point of interest for a lot of Filipinos is the fact that well, India is one of the biggest, if not the biggest, manufacturers of vaccines. And in fact, we were supposed to be getting vaccines from India. I think from Bharat in the next few months. Uh, of course, one of the many questions that we have is number one: do we still expect the vaccines we expect from India to arrive on time or as scheduled, given what's happening in India right now? That's
Well, for
one.
now,
Well, let me start with that.
yes, thank you. Well, for now, our vaccine cluster has re-strategized already, no? So we need to be able to adapt to what circumstances we have right now. And currently, India has stopped distributing their vaccines to other countries because they are trying to focus their response in their country. So with
Mhm.
that, the vaccine cluster headed by Secretary Galvez has tried to re-strategize, no? So we are now having other vaccines, no, for these following months, and we have temporarily placed on hold these plans for the Indian vaccines until we can see that they have stabilized.
Mhm, mm. Ma'am, let me also ask you as a health professional, what happened to India in the sense that they make all these vaccines, they export vaccines. I understand they exported 66 million doses already of vaccines. They vaccinated 130 million of their citizens, although that's only 10% of the population. Yet they still had this problem. I'm just trying to find learnings here. not to put any blame on India, but just so that we have a bit of clarity on what we can pick up from what's happening there.
Well, just like with any other country experiencing this increase in the number of infections, it's really multifactorial. If you look at that, of course, they have the largest supply of vaccines, but they were also, if you try to look at what happened to them, there was this loosening of restrictions, and then the
Hmm.
second was they have a very big population, and the third was the system which apparently they what they have right now is very weak. No, when we try to look at their hospital healthcare system, so it's just like what everybody is experiencing right now. The mix of factors where you loosen your restrictions, and then vaccination is not that scaled up. And then we have this factor and very big factor of the health system capacity.
I think it's interesting to note that I think it was only on March 7 when the health minister of India declared publicly that COVID-19 was at its end game in India, meaning that the virus was at its end. That was March 7, but before the end of March, there was a huge surge, and that's where they are right now. So, ganun po kabilis yung turnaround. I mean, I don't think anybody expected the virus to be that fast in turning a country's fate around.
Well, Robbie, if you will try to look at this, it's really a factor of governance and leadership. We really need to have that strong leadership and that kind of assessment and analysis when we do our things. So, looking at what happened to India, they had these two big religious events where a lot of people were there, and without any kind of precaution. So that's
Yes,
one. The
that's
second one.
The Kumbela Festival, 25 million pilgrims.
Yes. So that is where really why we always harp on and try to emphasize on the continuance of this compliance to minimum health protocols, because this is one of the things that really would save us, no, from this virus. If only everybody will try to cooperate and do this, we'll be able to cut the transmission of the disease.
Well, the other one, excuse me, the other one, I suppose, was the factor of the state elections. They had a very lively campaign period. I think a one whole month of elections, and they're beginning to count the votes right now. I also understand that also played a major factor in the infections. Not to mention, ma'am, I understand din na no, yung sabi nga ninyo nagluwag sila eh. I was reading an article just published yesterday. The health ministry was encouraging states to limit the number of people attending weddings, for example, to 50, and that to them is already a limitation. And limit the number of people in a funeral to 20. So medyo maluwag pa sila as it is, even right now.
Well, it really depends, no, on the setting and as I've said, on how they govern things regarding the response. But one thing I can tell you that, as I've said, whatever they are experiencing right now and the different factors involved in this increase in the number of cases, countries are also experiencing that. Even here in our country, we had that also. It's just that it depends on the capacity of the health system, and it depends on the regulations that we impose. So I think also that I just want to be clear on this, that we do not want to be comparing our situation with another country's situation. We're just doing this for maybe academic purposes so that we can better understand what's happening and we can prevent that to happen here in our country.
Yes, ma'am. Like I was saying a while ago, I'd like this to be a learning, just a learning point for us. Para namang it would be tragic if we don't even bother to learn from the tragedy in India. But ma'am, sige po. Moving on. Like you mentioned a while ago, well, things seem to have also changed in the local context. Octa Research just a few days ago said that our numbers seem to have gone down by more or less around 11%. So how are we as far as that is concerned? As
Well,
far as our numbers are concerned?
yes, the numbers are decreasing slowly. It's not really that significant yet, no. So if we look at the National Capital Region, our average cases, no, the 7-day moving average has really decreased. But it's in that slow pace where we also remind everybody that we should not be complacent at this point. Also, we can see that our hospitals are being decongested slowly because of the additional extra beds that we are putting up, and also because of the slow decline in the number of cases. But what we are seeing right now is an increase in the number of cases in the other regions. So this is what we are watching out for right now.
Okay, so we are having some relief in Metro Manila, but there is some concern over other regions.
Yes. And that is what we are trying to look at right now and trying to focus on so that we can be able to prevent also a surge in those areas.
Okay. Yusek Vergeire, ma'am, we will just go into a break. I hope you can stay with us. But when we get back from the break, we'd like to ask you for a bit more detail on what regions we have to be concerned with. Thank you very much. We hope you stay with us. We'll just go into a break. Okay, my apologies for that. I asked Undersecretary Vergeire to stay with us. Then I mistakenly pressed the button and I left the here. But I'm back. Yusek Vergeire, thank you for staying with us this morning. Well, just before we went into a gap, we were talking about some regions that we see some concerns because of upward movements in their numbers. Could you tell us about that? What areas are we looking at?
Well, we are seeing areas in Region 3, in Region 5, in
Okay.
Region 9, in Region 12. These are the areas that we are seeing a positive 2-week growth rate where we can see an increase in the number of cases as of this time.
Yes, ma'am. How would you qualify their movements? Are these points of major concern or just points of interest so far?
Well, when we look at the numbers, we don't just look at the numbers. We need to look at their healthcare utilization rate as well. So we need to look at the capacity of their health system to manage. Even if there are increase in the number of cases and your healthcare utilization is manageable, we can still be able to not tighten the restrictions. No, when we talk about it in the
Mhm.
IHF. Right now, we are seeing that Zamboanga or Region 9 is having some kind of challenge in their hospital healthcare system. So this is what we are trying to look at right now and trying to provide assistance with. As to the other regions, Region 3 also has this high healthcare utilization where their
Mhm.
hospitals also have that risk, no, of being fully occupied. So these two regions, we are trying to closely monitor. And as for the other regions, they have increase in the number of cases, but still their hospital capacity is still okay.
Region 3, of course, was the one was that region that was accepting our spillover from Metro Manila nung dumadagsal ito. Region 5, I think, is in Bicol, di ba? So doon medyo maluwag pa. I mean, tumataas ang numbers pero medyo maluwag pa yung occupancies.
Yes, so but we've heard yesterday that they also are able to was able to do localized lockdowns already, no, in establishments in other areas because of the increasing cases.
Mhm, mhm. Okay. Ma'am, let me go back again to the concerns over our protocols vis-a-vis what is happening in India. Yes, it is quite far away, pero we're also at a point when we are loosening up our economy a bit. We had new protocols put in place over the weekend. Given the concerns over what is happening in India, is there a need to review these protocols and reverse the protocols, the loosening?
Actually, we did review the protocols, no, especially for border control. But as to the opening of the other sectors, what
Yes,
we
ma'am, that
did,
one.
yes, we are trying to balance, no. So you know that, and it was really given to us through a cost-benefit analysis that a lot of Filipinos already do not have work. They are getting hungry, and this also can impact to the health of these people. That's why we're trying to balance. So right now, with what's happening all over the world, especially in India, what we are doing would be that we will need to strictly comply or implement our border controls. What we have had as a discussion last Friday together with the other concerned agencies would be how we can be able to strictly implement these border controls where we are able to maximize, no, and be able to ensure that these returning Filipinos or travelers coming in the country would complete their 14-day quarantine. We'll be able to test them at the most appropriate time, and we will
Mhm.
be able to isolate those who are sick. So this is what we are doing, and hopefully with this border control, even though we open up gradually and this calibrated mechanism that we're doing, we'll be able to prevent the further spread of variants here in the country.
Yes, ma'am. Ma'am, I was also asking about the new protocols with regard to the other sectors that were opened up over the weekend. Yung 10% for indoor dining and yung 30% for personal care services. I asked about that kasi remember mga 2 weeks ago lumabas dun sa the Lancet yung study ng 6 researchers on the possibility of COVID-19 being airborne. Although hindi sila ganun ka confirmatory in the sense that they were only looking at 10 apparent proofs of airborne transmission. Um, Kasi we were talking kanina to Yusek Bismonte of DTI about ventilation. Um, Ventilation, of course, is one of the requirements for a safety seal and for opening an establishment. Pero parang hindi ganun kaklaro kanina exactly how is proper ventilation measured. Kasi it's not as easy as as observing people whether they're wearing face masks. Ventilation has to do with studying air movement and circulation and exchange and all that. I'm wondering if we have the capacity as the government or as your department to measure and to qualify the ventilation in these establishments, or we need to upgrade that.
Yes, actually, we have a tool that we will use, government will use, so that we will be able to assess, no, each of these establishments or workplaces ventilation mechanisms for now. So these are very simple tools, no, not really highly technical that you'll be able to measure all of these particulates in a specific setting. One of the measures that they will be using, of course, would be observation. No, so when they go there, do you have enough windows that you can open it, and
Mm-hmm. Mm-hmm.
the second would be your air conditioning system. Does it have this inflow and outflow of air? And if you do not have these first two basic things, then you would need to have these HEPA filters. No, so these are very basic and easily implementable mechanisms for us to ensure ventilation in establishments. We understand and recognize the fact that there are small industries which cannot really have this kind of highly technical ventilation mechanisms in their area. But for the most and at the very least, we are requiring these big establishments, no, especially in malls which are very enclosed, that they should have this kind of ventilation standards. Now, what we are doing right now, we decided that for us to be able to have that kind of rational basis for opening up establishments and workplaces, we
Mm-hmm.
should be able to rely on the safety seal requirements. And these safety seal requirements, aside from ventilation, have other aspects as well, or components, where the establishments have to be able to uh, implement and comply with the requirements so that they can level up and they can open up some portions of their establishments after they can implement, no, these kind of standards.
Okay. Ma'am, lilipat ako ng konti ng topic, yung ivermectin party ni Congressman Defensor at ni Congressman Marcoleta. Uh, well, I do remember, ang sabi kasi ni FDA Director General Eric Domingo, so long as meron kang valid prescription at meron kang compounding laboratory that will inspect that valid prescription, walang problema yan. Pero mukhang sumabit doon, at least by appearances, mukhang sumabit doon to some degree yung ivermectin party nung Huwebes ng dalawang congressman kasi uh, some of these prescriptions were written on blank pieces of paper. Well, of course, we're not doctors, but we also need to get this from you guys. Is this legal? Is this allowable? Is this acceptable? For example, in cases of emergency, or talagang hindi po pwede. What's the rule on this?
Well, we have numerous laws, no, that would state that a valid prescription should be there so that you can be able to dispense medicines, and individuals can take this medicine. So, looking at how things have happened, and allegedly, no, may mga pinapakita po mga papel na hindi po kompleto ang prescription. That in itself is violative already. So, yun po yung tinitignan natin, and we have recommended already, communicated officially to the Professional Regulatory Commission, because this is a practice of medicine also, so that they will be able to investigate, no, these physicians who have issued out this invalid prescription. Also, we have referred this to the Food and Drug Administration, because in the law, the Generics Act, also the FDA law, and as well as the Consumers Act law, no, na meron po tayo talaga nakalagay dyan na dapat valid ang prescription mo bago ka makapagbigay ng gamot. So all of these are being investigated right now, and we'll try to see, no, whatever information we can give in the coming days.
Mm-hmm. I also find it curious, but let me just ask this. Let me just ask this. It's just something that crossed my mind. I used to think kasi that prescriptions are a personal thing. I mean, you give a prescription to a patient that you are familiar with, or that you know. Uh, but is it unusual is it unusual to have a mass prescribing event, if you might call it that, kung saan pumunta lang kayo dito at magbibigay kami ng reseta? Is that even allowed? Iba pa ma'am yun sa iba pa ma'am dun sa paggamit ng prescription pad. Pero yung the fact that you have a mass prescription event, is that unusual or is that allowed?
Well, usually, sir, no. So if you prescribe of symptoms, but they were given this kind of drug, and this in itself would mean that people can take it as a preventive measure, which is very wrong. Because there would be this false sense of security, even if we say that ivermectin is generally safe, but there are still side effects that the person can experience. So we are urging our public, encouraging them, please wait for DOH to issue the right advisory whenever we get sufficient evidence already that this drug can be used.
Mhm. From what you mentioned a while ago, ma'am, it looked like the government is looking at the potential liabilities of the doctors involved. What about the organizers? What about the congressmen involved? In the end, they were the ones who put it together. Is that also within the ambit of the investigation, or would that be a separate case altogether?
I guess this will be a separate case. This we would need to really investigate further and look at our existing laws. But right now, what is very clear and based on our existing laws is the liability of the doctors, no, on the invalid prescriptions and also their practice of profession. So we have, as I've said, we have referred this to the Professional Regulatory Commission for them to investigate.
Okay, ma'am, I have one last set of questions before we let you go, and I do hope you have a good week ahead. But let me ask you this, because I was reading a report coming from the Bureau of Investigative Journalism in the United vaccine to arrive mid-February in the Philippines, pero naantala because of the indemnification law, which we passed anyway in February. So, but that was going on 3 months ago, and Pfizer's vaccines have not yet arrived. From the Bureau of Investigative Journalism, uh, supposedly cites reports from Argentina that I'm wondering if we have any similar conditions placed on the Philippines for the Pfizer vaccines, aside from the indemnification fund?
Well, as far as I know, Robin, no, let's make it clear. It's really Secretary Galvez who answers these kind of questions. But as far as the faced during the supposed deliveries last February was because of these indemnification provisions in.
Yes, ma'am.
So that is all that I know. No, aside from that, maybe Secretary Galvez can answer that.
Okay. Okay. Well, I just had to try. Baka sakaling nabalitaan po ninyo. Well, maraming salamat po. Undersecretary Maria Rosario Vergeire. Ma'am, we hope you have a good day today. And Rosario Vergeire of the Department of Health. And this has been Agenda. Thank you for joining us. I'm just sitting in on behalf of Cito Beltran. So keep it here in One News for more of the day's biggest stories. I'm Ed Lingao. We are One News.